This is just to show this mare from the prison system. She's probably going to be with us for 3 or 4 weeks. She's got a pretty prominent brand here on her shoulder. And her left rear leg is what she spoke through a barbed wire fence. She is in foal. She got her leg tangled up in some barbed wire. The white area that you see right in the middle of this picture is down to the bone. Even the periosteum has been peeled off of the bone in that area. The tissue, piece of tissue that I'm putting my finger on, this saphenous blood vessel and artery were in that piece of tissue. This is just to show how much this baby has grown since we started treating this mare. This baby was born about 8 days after we started treatment. Nice picture we're going to take of this prison mare. This is Earl Pepper, who's in charge of the horse program here at the prison system. He's the reason this mare was brought to be put in the treatment system. She has a baby that he's real proud of. And I've come down here to the prison system today to put on a program for the Farm Bureau Equine Division. And this is the final picture of this mare that we've treated. I think this is 104 days from the time that the accident happened. I've already stated that this is probably the largest scar that we've sent any mare out with. But the front part continues on around with the same thing. I anticipate this wound from an inch inside of the leg will be healed with no scar, no healing, no scar evidence, and the hair and the pigment will all be normal tissue. They've been treating this horse for 10.5 months. The lady who owns the horse is a nurse, and she has used the wound treatment that she's learned in nursing in addition to the consultation and advice of the veterinarian. Granulation tissue has been cut back. This horse was healing pretty good and was totally sound until 2 days ago, and the granulation bed broke open. And when she steps on this left leg, you can see the end of the tendon protrudes through the rent that occurred in the granulation tissue. Just to show how far this tendon does protrude when the front leg is picked up and she has to bear weight on this ankle. We have 5 other horses. Say, Teresa, you're on camera. So,
I'm on camera. I just think we've been really happy with the success we're having finally. Didn't ever think we'd get to this point with what we started with. She seems sound, and we're anxious to get her started back, and hopefully she'll be successful at that.
Well, we hope to see you at the state show next year. That's where we started off talking about wound healing this year, was at the state show. So maybe we'll be back on a different page. 90 days, trying to get her ready for Oaklawn. We have a trailer accident where she's been kicking the wall, and we would call it a degloving type accident. Happened, this is the first day. This wound happened yesterday. She's torn the lateral digital extensor loose at the hock level. She also had a lot of swelling and inflammation developing on this plantar ligament going down the back side of the leg. We are treating this horse. I'm galloping this horse every day, and that is having some effect on our healing, but the owner is interested in getting this filly back to the races, and that was what we started initially. It feels good, and it's very active on this leg. It was the second time we've demonstrated this, and as I repeated, we'll probably send her to the track on next week.
The leader is Annie's sister Ida. Angel Wine is second. Miss Dowden coming on in third. It is Annie's sister Ida. Angel Wine trying to run her down. Miss down to the outside. Angel's sister Ida, or make that Annie's sister Ida. Angel Wine at the wire. Annie's sister Ida. Angel Wine trying to come get her. Annie's sister Ida hanging on gamely. Angel Wine second and Miss Dowden third.
Injured her left rear leg. She's cut the extensor tendon right below the hock completely in two. The lateral digital extensor is exposed. All the tendon sheath is torn off it completely. The saphenous vessels, all the blood vessels inside of the right rear leg on this mare, as you can see, we haven't cleaned the hay off of it yet. And this skin is torn loose and goes all the way to the posterior part of the leg, very close to where the superficial flexor tendons come. Here you're seeing the front part of the bone. Here you see how far this wound goes back. Cases we worked on at the farm for about 6 months, and then Mr. Cook has been working on her back here. She's also became a TV star. She's a nice old mare that follows him around, does anything he tells her to do.
You through eating the hen?
Yeah, do you ride her, Harold?
I've rode her about 3 or 4 times.
Have
I
you?
ride her anytime.
Right, okay.
She don't show any signs of effect of a limp. She don't show any signs of it hurting.
Right. No,
I hadn't really run no cows, nothing like that on her.
Yeah.
Just far as riding her, kick her up to a cannon.
Right.
Hey, let her run.
Yeah.
She can run just as normal as she did before that.
Right. This is the first evidence that we've known about having a piece of tendon sticking in here. You have any attitudes about what we've done and what you think about your horse?
Oh, I'm tickled to death. They told us it would be months and there wasn't anything left to work with. It was just got ripped off.
The horse did have one.
And Carolyn rides with a 15.
What's been your best barrel run as far as you're concerned?
15.7.
15.7. Where did you do that?
At the Marshall.
And if you get the best time, you get 10 points, and you've been in 5 of them, and you got 50 points so far.
Yes, sir.
Good. Okay. And then you're going to end up winning a saddle, do you think? Yeah. Gotcha. Is 4 days old. This is bone that we're looking at, and I've already cut off a piece of tendon, the extensor tendon. There does appear to be some roughening on the surface of the bone, which makes us suspicious that we might get into some.
For someone, I have been in the horse world for 48 years. And this absolutely amazes me. This healing process is something that I've never seen, I've never witnessed. I went to vet school at the University of Auburn, and they didn't teach anything like this. I am beyond pleased. I am thrilled beyond my wildest dreams because I've got him back, and I thank you for that.
Well, it's by far more than what we ever, I never thought it looked normal again. When you go from something like that, that's just a big nub of raw meat.
Right.
to an actual footing.
Finch. She's 79 years old, but celebrating her 79th year. And she found this horse caught up in the top of a tree, according to the... What's the history on getting into the tree, Mary? Was it a...
She rolled over. And
forward, Eddie, so I can shoot the back legs. Oh, that's good.
The fork of a tree coming out of the ground.
Oh, okay.
There was a double tree coming out of the ground.
I see.
And her leg wedged in the fork of the tree.
Uh-huh.
Her right leg.
Okay.
And her left leg was in front of the tree, so she rubbed up and down on the back part of her left leg.
Okay, let me come back. Been treating the wounds in addition to breaking her. This has worked out pretty good. As you remember from the front interview, Mary's 79. She allowed she really should be giving up horses, but I think she's finding it hard. This is a farewell address to, what's the mare's name?
Roxy.
Roxy and Mary Finch, and we're giving Mary a chance to give her salutations.
Well, this is a long-awaited day. It took a long time getting here. It's April 9th, but I'm taking this girl home today, and I'm really proud of all the good care she's received down here. These guys are responsible for saving her life, and I'm so grateful, and I'm so proud of this mare. I think she looks so good. She's so beautiful.